Hi, my name's Sam Atkins. I work for East Lancs Trust. I am an operating department practitioner, which means my role is based in theatre. My role now at the minute, I'm a team manager, so I help look after the coordinating of the theatres. In the morning I start and make sure all the lists are starting on time, that we've got no issues with equipment, and just general staffing and skill mix is fine. And then keep on the day-to-day timings and make sure hopefully lists aren't overrunning, or if there's any issues then we'll deal with them. The beauty of the job is I get to meet a lot of patients, can provide lots of reassurance to the patients. For example, I looked after a lady the other day who was coming in for an injection into her hip. So it's just explaining to the patients what the process is, giving them reassurances. I took her into the room, got her positioned that I needed to for the surgery, put on the necessary monitoring just to make sure that she's safe throughout the procedure. And that she's well cared for. And then it's about chatting with the patients, probably because when they're at the most vulnerable, and they're scared and they're not quite sure what's happening. So it's just giving that reassurance and care and comfort as part of my role. And then this lady in particular, it was all done the injection and she couldn't really believe it because we'd been chatting, she'd not been really aware of what was going on. So that she was so grateful, and it was that makes you feel really good as a ODP, I think, to look after that patient and know that you've done a good job, you've cared for that patient, and they've gone out happy with what you've done. So I returned her back to the ward and she had a sandwich and a cup of tea and then went on her way, hopefully, of having that good experience that I was able to give her during my role as the ODP.